This is Guardian Radio 96.9 FM, Nassau, Bahamas.
The views and opinions of the hosts and guests are their own and do not necessarily reflect the position of the management and staff of Guardian Network.
Hello and good night and welcome to the Doctors Inn. Thank you for joining me, Dr. Janothra Archer Cartwright, family medicine specialist for all things health, wellness, and things that pertain to the Bahamian Society. I just want to thank you all for joining me at our new time at 6:30. Just a reminder for everybody, we're no longer in the 7:30 spot. We're on 6:30 on Guardian Radio, and you can hear us on GuardianRadioTalk.com as well as we are on Facebook. The Doctor is in with me, Dr. D. Archer. You can find us there. If you want to catch up on the shows, we do post them there so you can catch our lives if you haven't caught us on the radio. But we want you to tune in and listen in and participate and to join in. Of course, brought to you by Medical Concierge Services for all your medical care needs. And of course, we take care of children all the way up to adulthood, our elderly patients. And we have a variety of in-clinic and out-of-clinic services, including concierge care. So even if you can't come to the clinic, we can come to you. Give us a call, 326-1521, or you can WhatsApp us, 432-4010. And you can also use any one of those lines to sign up with us for NHI. We make it really convenient for you, and we help you through the entire process. So you just call us, give us your information, and we can get you all set up for NHI. So come on in and check us out. So we're here on Guardian Radio, the numbers, because you can join with us tonight if you want to come in on the conversation, 322-6232. 325-4316, 325-4259. We're remote, so please don't text us and don't call me on my cell phone. We know lots of people have my cell phone number, but don't call me on my cell phone. That happens quite a bit, so I won't be able to take your call. You want to call into the station, and we can take your calls there. Now, those of you who are on my Facebook page or even on my personal page, you would know that it's Diabetes Awareness. It's a really nice poster. I'm one of the doctors on it, so go and check it out. Where we're just bringing awareness to diabetes. It's kind of an international thing, so they asked me to participate, and I was able to be a part of that. So I thought that was really cool, and it's a really, really nice poster. It has some really good pointers on there for tips for diabetes. So I thought we would end off the month of November with a more in-depth discussion on diabetes. It comes up throughout most of our topics, and we might have touched it in the past, but I really wanted to go through it since it was Diabetes Awareness and just talk about this because it is a major chronic illness in our country, and so many lives are touched by diabetes, and there's so many different things that kind of come off of it. And if you have a question tonight, like we said, we are willing to take your questions. So when we talk about diabetes, what exactly is diabetes? So diabetes really is a disease that affects, it's because there's a lot of what we call blood sugar or high sugar in your blood, something that we call glucose. And when you have problems with this, when you accumulate too much of this so-called sugar or glucose in your blood, you get the disease called diabetes, and that can affect a lot of different things in our body and create lots and lots of complications. So glucose in itself is not a bad thing. It's one of the main building blocks for energy in our body. It helps to make energy for our cells, our muscles, our brain, everywhere. Every part of our body needs glucose to help as a source of fuel in a sense. So that's like a petrol in the tank. So we do need it. So why does it become too bad? Because the body is something that always has to be in constant homeostasis, or what we call balance. And so anytime you have too much of one particular thing, it becomes problematic. And the body has to figure out, what do I do with all of this excess sugar that's in the body? And this can lead to very serious health problems. And so when they have these serious health problems, initially people aren't aware that their sugar has been high. And usually by the time you get a diagnosis, unless you're seeing a doctor commonly, like annually or more than that, sometimes you may not have what's going on. So let's start by talking about the fact that there are different types of diabetes. And you might have heard people saying stuff like there's type 1 diabetes, type 2 diabetes. There are a couple others too. We've got gestational diabetics. These are persons who only experience the symptoms of diabetes or have elevated sugar when they are pregnant. And so we call them gestational because it's more transitional. Usually after the pregnancy is over, after they give birth, they would go back to normal numbers. But we'll see as we talk later on that some of these people may actually progress to being diabetics. And what most likely it is that they are pre-diabetic, which means that they're on the verge of being diabetic, and maybe the pregnancy condition really kind of brought that out. So you really want to be careful if you had diabetes in pregnancy, will you become diabetic later in life? So our pre-diabetics, and that's something that we've talked about more so in recent years. So either you were diabetic or you were not diabetic. But today we talk a lot about pre-diabetes. So these are the people that are encroaching being diabetic. They're very close. They may not be to the point yet where they require medication, or they might need some medication in lower doses, but they're the people who are trending towards being diabetic. So we look at those numbers and we try to work hard with those people very aggressively so as not to end up being diabetic in a sense. And so we monitor the blood sugar of our pre-diabetics and our diabetics and our gestational diabetics. So the things that we would look out for in terms of what are the symptoms of diabetes, very important. And these symptoms can be seen in both our type 1 and our type 2 diabetics. Just a little bit more on kind of the type 1 diabetics, because type 1 diabetics tend to be our younger diabetics. It can kind of happen at any age, but they tend to be children or teenagers that tend to develop type 1 diabetes. And these would be the diabetics that would usually need insulin right away. So these are our insulin-dependent diabetics. They don't take oral medication per se. And then we have a few like strange occurrences that happen in between with some of the teens and the younger adults. But the type 1 diabetics usually will be our insulin-dependent diabetics. Now, our type 2 diabetics, which can also happen at almost any age, but usually these will be our persons over the age of 40. Now, we're seeing people in the community coming with diabetes a bit younger these days because of diet and environment and stuff like that. But traditionally, these patients would be our patients who are a bit older, who might be in their 40s or above. And they would be our type 2 diabetics and more likely to use pills, tablets, that kind of stuff. But of course, we start with our lifestyle. Hello, D'Angelo Menace. Shout out to you on our Facebook page. Thank you for tuning in. So those are kind of the two main groups. And then we kind of want to look at, so what do you look at in terms of symptoms of diabetes? And these are things that you can look out for because if you see these happening, if you're concerned, then this is when you want to think about Do I need to get a checkup? Do I need to see what's going on? So feeling very thirsty and feeling thirsty often. So you could be drinking and drinking and drinking, and you just never seem to not be thirsty. That's one of the main signs. There's kind of three things that we look at for most diabetics, and then there's other symptoms. But that's one of the big three. So if you're thirsty all the time, then, and there's no reason, you're not dehydrated, you're not out in the sun, but you're constantly needing and requiring more and more to drink, that could be a sign. And you hear some people like, I'm drinking all the time. I don't know, I'm always thirsty. That could be a symptom of diabetes. And so, of course, if you're drinking all the time, you may be passing urine all the time. So urination frequency, constantly having to go to the bathroom. And kind of the difference I find between people who have a urine infection or a UTI versus someone with diabetes is that they tend to have lots of volume, lots of urine that comes up. So every time they go to the bathroom, they still have a good amount of urine that's coming in. Where people usually with a urinary tract infection will say, it's small amounts of urine, very frequent. Sometimes I can't even get much urine out. I just feel like going to the bathroom. You find with the diabetics, because a part of the body trying to balance itself is to get rid of that excess sugar. So what you're having is the body using the kidney to kind of flush all of that out. So your body's triggering you to drink a lot of fluids, and then your kidneys are being triggered to try to release that sugar outside of your body. So you're drinking a lot and you're passing a lot of urine. Losing weight. Losing weight without trying is usually a symptom that you want to get worked up. So you've been doing your regular thing, you haven't changed your diet, you haven't been exercising, just your normal routine, but you're losing weight quite quickly, 5, 10, 15 pounds over a very short period, maybe a month, 2 months, 3 months, and you just can't figure out what could be causing this weight loss. That could be one of the symptoms. So those three are probably going to be your top three: weight loss, increased urination, and being thirsty all the time. There are some other things that we look at as well that are a little bit less, insightful, but could be a part of the situation. If you're feeling tired or weak or fatigued all the time, if you're having irritability and mood changes, you just, for some reason, you're just irritable and moody. It's not you. It's not your regular self. You want to get that checked out. That can be diabetes. That can be thyroid disease. You want to come on and check that out. Having blurry vision. We'll talk about the consequences of diabetes, and it does affect your eyes in a lot of cases, what we call microvascular disease. So you want to get if your eyes, all of a sudden, you realize recently, things seem a lot more blurry than normal. You want to come and get your eyes checked, get screened for diabetes, that kind of stuff. If you find that you're having what we call, Bahamians call them sores or lesions on your legs or your body, and they're not healing well. So a part of having really a lot of sugar inside the body is you have a sluggish white cell, so it's hard to heal and to fight infection. And so if you find that you're not healing well, you've had this cut or this sore for a very long time, you can't seem to get it healed up. You keep looking at it, it's still wet, it's still weepy. That might be an early sign that you're diabetic, or that you've even had diabetes for quite some time, and now it's causing what we call peripheral vascular disease. If you tend to be getting a lot of infections, and you can't figure out, why am I always getting sick? And it's like weird little infections that you wouldn't normally get, like, infections in your gum, on your skin. You're having vaginal infections, lots of yeast infections can be a sign of diabetes. So if you're having a bunch of small, little infections here and there, it seems pretty persistent, you want to get checked. And then, of course, if we were to check your urine, if you were to have ketones, something that we look forward to without starving yourself, then that may be a sign that your body has been trying to rid itself of a lot of sugar. So those are really the big kind of signs that you kind of look for to determine if you or a family member may be having diabetes. And you want to get that checked. You want to get that checked as quickly as possible. So if you think that you or your child has diabetes, of course, you're going to go to your doctor. And if you've already been diagnosed with diabetes, you have to make sure and do all of your follow-ups. Extremely important. So how do we determine if someone has diabetes? Well, there are varied tests that we do, and we also stratify people based on their risk. So anyone, if your BMI is over 25, so that's your body mass index. If your body mass index is over 25, which will put you in the overweight category, and you have certain risk factors such as hypertension, high cholesterol, if you're simply very inactive lifestyle, if you have a history of polycystic ovarian syndrome, which is something that some of our younger patients may come in with. I find that more so women in their 30s, they're having some PCOS symptoms, they're worried about fertility, and usually we have to check them for diabetes. So if you have some of these risk factors, or if you have a close relative with diabetes and your BMI is over 25, that's when we would kind of look to screen you for diabetes. If you're over the age of 35, you really don't have to have symptoms. We can put that in there with your annual test, and you can get that blood screening done. Women who have had gestational diabetes, as we talked about, so those women who've experienced having diabetes in their pregnancy, they're going to be a bit more prone, and so we would watch them and do testing for them a lot earlier. And anyone who's had prediabetes, so if you've been diagnosed with prediabetes, you may not be on medication. Of course, we'll be looking at your numbers and making sure that you don't move towards being diabetic. And also our HIV patients, we also advise them to get tested as well. So what kind of tests do we tend to use? Now, most Bahamians are very conscious of what we call the random glucose test. And that's when you go to the doctor and they stick your finger, they take a little sample of blood and they stick your finger and you get a reading or a number. And that's what we call like a random glucose test. And we have to take that a couple of times to kind of really see if you're diabetic or not. And so we look at that based on if you are fasting, in other words, you haven't eaten for the morning, versus if you've eaten. And that gives us two different numbers. That first number, if you haven't eaten, we expect that to be a lot lower. Normally people will be, that number will be between about 80 to 100, give or take, depending on the lab that you're using, maybe even up to about 110. And that's usually like your fasting. So if you're not diabetic, usually your numbers are going to be lower than that, 100, 110. And if you have eaten and you take a random glucose, just a little prick of your finger, we expect that number to be less than 200. So if you're getting numbers that are over that, then we would think about whether you might be diabetic. Usually with a random, you're not going to be tested just once. They're going to get 2 to 3 readings from you and kind of make a decision based on that and maybe do some further testing as well. So that can be done randomly. And then, of course, we talked about that being fasting. And they would determine as well if you're pre-diabetic, if you're kind of like 120, 126 or something, so like that, then, you would be a pre-diabetic. We also do what we call a glycated hemoglobin, or what we call an HbA1c. And you might have heard your doctor saying, well, your HbA1c is such and such. And that really gives us a percentage-wise of the sugar in your blood. So you really want that number to be less than 6.5. Anything 6.5 or higher, and we will deem you diabetic. And I tend to like using the HbA1c because it does give you not just a snapshot of how the patient is doing right away, right at that moment in time, but in a broader sense, we can tell what's been going on in your blood for the last 2 to 3 months. And that's a lot better indicator of kind of like the average of what's going on rather than maybe a snapshot. So if you were to eat like a hamburger or a really hearty meal and you were to take that test, your sugar might be a bit higher. That might be a one-off type of thing. But when we look at your HbA1c, we have kind of like an average of what's been going on for the past few months. And that gives us more of an indication of your routine and what your blood sugar would look like, the lows and the highs all together wrapped in one. So I like to do an HbA1c. And those with pre-diabetes will be closer to that number, between about 5.7 and 6.4. So you want to be around a 5.7 in order to be far away from diabetes. And then in the past, and sometimes with our pregnant patients, we do what we call an oral glucose tolerance test. And that is where you fast overnight and the fasting blood sugar is measured. They ask you to drink a sugary drink, and then they measure the blood levels afterwards in about 2 hours. And they're looking for the sugar to be less than about 140 on that test. And then if it's more than 200 after having that sugary drink after about 2 hours. And so if you're pre-diabetic, you're between 140 and 199. So usually if on the wards, I would see it that we would do that more often with our pregnant patients or our patients that we weren't quite sure if they were diabetic or not. We kind of challenge them in the sense to see if their sugar would go up if compared to if they had a sugary drink. And so we would do that type of testing. And we would also, if it's an acute case where we think your sugar is elevated, we might actually ask you to do a urine analysis where we look at the urine. And we mentioned it earlier that you can have something called ketones inside of your urine, which would allow us to know how your body has been basically dealing with the sugar in your body and how it's been passing outside of your kidneys. So there are lots of different tests that we kind of do to kind of figure out, is a person diabetic or not? And we use those tests to make a determination about what we should do with you, basically. And by doing that, we have an indication of how we would start our treatment program and what that would look like. A couple other things that you can look out for. Dry mouth is also one of the things. Some people also experience numbness or tingling of the feet. And that kind of brings on some of the things that are going on in your body in terms of what diabetes may be doing. Now, one of the big complications for diabetes and having sugar inside of your body for a very long time at a high level is that there are quite a few complications related to it. One of the number one complications, which is also one of the number one killers in the world when it comes to chronic disease, is cardiovascular disease. And this can include coronary artery disease, which can come with chest pains, heart attacks, strokes, high blood pressure, high cholesterol, and atherosclerosis, or the narrowing of your blood vessels. People also have nerve damage, and that's why some people get the pins and needle feeling. And we call that a neuropathy. And that causes numbness and tingling. And that can start in the toes and the fingers, and that can spread throughout. So that's not a really good sign. And if you're feeling something like that, you really want to come in and get tested. Kidney damage. The kidneys can be damaged by having high sugar, and this can lead to kidney failure. And that's how quite a few people end up on dialysis or needing a kidney transplant. Eye disease, as we talked about, and we're going to call that retinopathy, that can lead to blindness. So you have people who lose their eyesight because of diabetes. They can also end up with cataracts and glaucoma. And with that neuropathy and that cardiovascular disease, people can have a lot of nerve damage. We can lose to poor blood flow and poor healing of cuts and sores, as we talked about, skin infections. For the men out there, and if you had seen me on another show, erectile dysfunction. So those men out there who don't want to take their diabetes medication, that can be a complication of diabetes, erectile dysfunction, and depression, dementia, and dental problems. So there's a lot more things that can be a complication of diabetes than we think about it in every day. And we split those up into micro and macro. And when we talk medically, because we talk about the large organs that get damaged and then the smaller organs that get damaged. And so you can see almost every part of the body can be affected by diabetes in some way. And so we really want to think about that. And for our pregnant women, it can also lead to a condition called preeclampsia. And this is where your blood pressure is really, really high and you have problems. You have protein in your urine, legs, and feet. And those people also have a risk of gestational diabetes and problems in their future pregnancies. In newborns, if the mother is diabetic, this can cause an issue with the birth weight. It can be higher than normal. So very large babies are born. They can have low sugar at birth, and this can be a problem because the baby can come out and the baby can crash, and they may not know why, so they would have to check the baby's sugar level, and that means that the child is also probably going to have a risk of having diabetes over time. So these are really, really important things to kind of know about, and some of the major consequences that are going to do. And so it's important for diabetics to know which are their goal numbers. So you want to sit down with your doctor and talk about your goal numbers so that you have an idea of what your sugar should look like as a diabetic on your everyday, and try to keep within those numbers, because when you do go outside of those numbers is when you do have a lot of those complications. So we're going to talk about how do we manage our diabetes after we take a quick break. So producer, if we could go to a break, and we'll be right back on the Doctors In with Me, Dr. Diabetes, to talk about management. How do we make sure that our blood sugar is not high? Back in a moment.
Always on the go? Missed the show? You can now listen to Guardian Radio talk shows anytime, anywhere on Spotify and YouTube by searching Guardian Radio 96.9 FM or by entering the name of your favorite show. You can also listen by logging on to GuardianTalkRadio.com and clicking on the podcast tab. Guardian Radio, continuing to provide you with fresh news and smart talk anywhere, anytime, all day.
Girl, Junior just showed me Bella Boy in his phone.
What you mean? He take picture of that good-for-nothing boy?
Shh, you don't want Bella here. You say that. You know she always say that's my good child.
So what he doing in Junior phone?
Oh, he there because the police looking for him. He on their wanted list.
Wanted persons in your phone now?
Yes, child. And when police want to find anybody quick, after something happen, they can send picture direct to your phone. Go to Google Play or App Store and search for Crack Crime Bahamas. Then pick install and it will go straight to your phone.
There is also a section on missing persons.
Yes, girl. Everybody needs to get this app so police can tell us right away when these people go missing. Just like an alert system.
Yes, it has numbers for Crime Stoppers Bahamas, so you can call and nobody knows it's you. Call directly to Miami and give the information without giving your name or anything about you. I tried the other day, and when I hear Junior and his boys talking about where they hide those guns, I walk quick round the corner and call that number.
Call 328-8477 from Nassau or 242-300-8477 from the Family Islands. Your print needs are short or long run, digital printing, wide format, or print consultation. Call the best. Call Printmasters. They have been in the printing business since 1957 and are a printing company with a tradition of excellence. The goal of Printmasters is to provide their clients with the highest levels of personal professional service at an affordable price, along with the technology that makes working together efficient and easy. Laminations, business cards, flyers, posters, window and floor decals, and just a few of the digitized printing services offered at Printmasters. Call 302-2361 and print with the best. Print with Printmasters.
This is Guardian Radio 96.9 FM, Nassau, Bahamas.
Hello, good night, and welcome back to the Doctors In with me, Dr. Denethra Archer Cartwright, family medicine specialist and consultant. We're talking about diabetes tonight, of course, brought to you by Medical Concierge Services for all your medical care needs. Check us also on our website page, mcsfamilymedicine.com, and you can see a variety of different services that we offer. If you would like to sponsor the show or have an ad or participate in some way, and just to support us, 326-1526. You can get me at the office number. And of course, you can join into the conversation tonight, 322-6232, 325-4316, 325-4259. We're talking about diabetes. It's Diabetes Awareness Month this November, participating in just awareness for that. And so I hope you guys can check out our poster on one of my pages, The Doctors In with me, Dr. D. Archer. It might be on my Dr. D. Archer page as well. Just a few tips on diabetes. So I thought I would expand tonight because it always kind of comes up, but we want to go through it in detail because we know that diabetes affects a lot of people in our community. So how do we manage this? How do we go about managing if our sugar is quite elevated? And so there are three kind of things that you want to do. So if you're already diabetic, or if not, you want to keep your numbers within the normal range. And we do that by diet. And if you are already diabetic, some of you may be on medication, so it's important to take your medication every day. And by increasing your activity level. Yes, shout out to Citizens for a Better Commonwealth of the Bahamas. Thank you for saying good night to me. Welcome to the show. Thank you for watching online. You also want to maintain your cholesterol. We have talked about all of these things before and how all of these chronic illnesses are so well connected. So you want to maintain your blood cholesterol, your HDL, and your LDL norm levels. And you also want to watch your triglyceride levels and keep them as near as possible. You want to manage your blood pressure. And so for blood pressure, that is keeping your systolic or the top number less than 140 and your diastolic pressures less than 90. The keys to managing your diabetes is wrapped a lot up in the diet that you're going to eat. And a healthy meal plan is extremely important. So one of the first things that your doctor is going to talk to you about is what should you be eating? And a lot of people get confused with this, and they don't understand what creates the sugar in their body. So it's not just eating like sugar from, the little sugar container. Sugar can be found in various foods in both a simple form and a more complex form. So your simple form would just simply be your sweets, your sugars, your sodas, those types of things. But you have more complex sugars that are a little bit better for you, but you want to watch and maintain a balance with that because when you're diabetic, those sugars get broken down and they add to the high levels of sugar in your blood. So you do want to balance that out. So you want to go for more of a Mediterranean diet, which is going to be heavy on your vegetables, your fresh, healthy fats. It's going to be low in sugar. You've got your fruit, you got your whole grain, and, you'll have your protein. So protein and vegetables tend to be a lot better combination for our diabetics. And of course, there's the DASH diet. There's a variety of diets. And you want to sit down with a nutritionalist at some point and talk about what it means to be diabetic and what foods are going to elevate your sugars. There's a handout that I give some of my patients about foods with what we call a high glycemic index. So these are the sugars, the foods that are going to raise your sugar really, really quickly, and those with a lower glycemic index. And these are the foods that are not going to raise your sugar as quickly. Of course, we're talking about also, so once you've got your diet plan down packed, you want to exercise regularly. And that's 30 minutes most days of the week. And, you can start with walking, jogging, whatever that you can handle. That's going to be extremely, extremely helpful. You want to achieve a healthy weight. So we talked about the BMI, and we know it's really, really hard. And especially Black people tend to be, a little bit hard to kind of fall into some of those BMI numbers. So what I do is I try to set targets that are reasonable for my patients. Because if you were to lose about 5 to 10% of your body weight, you tend to see a lot of health benefits if you're struggling with some type of chronic disease. And of course, taking your medication if you need to. Nobody likes to take medication. Nobody wants to take insulin. For my younger patients, I try to keep them off of insulin as much as possible. So treating very early, very aggressively. And then hopefully some patients we can treat without that by just lifestyle modification. And that's really the goal. If you can get as many patients as you can that do not require medication, it feels pretty good. And so you're going to have to get yourself a glucometer, so that you can measure your sugars at home as well as your blood pressure levels. Okay, question, Dr. D, is there any relationship between diabetes and kidney failure? Yes. So we just touched on this a little bit earlier when we talked about the complications of diabetes. But yes, diabetes affects the kidneys quite a bit because you remember, how does sugar get out of the body? It's filtered out of the body through the kidneys. So if the kidneys are working very, very hard to get that sugar out of your body, what you end up with is sometimes a pathway to kidney failure. So not controlling your sugar, having high levels of sugar in your body, quite a few of these patients end up getting kidney disease. So there is a really close association, and one of the major complications of diabetes that people don't think about is kidney failure, which, kidney failure is a really hard one because we don't do kidney transplants like that in the Bahamas. At least I know someone was trying to do a program, but I'm not sure if it started. So finding a brand new kidney is extremely problematic. And the other side of that is then having to probably go on dialysis, which is no picnic. All right. So kidney disease and diabetes are very, very closely linked. Because what you find, and it's like we talk about kind of like a chicken and the egg sense, once you have diabetes, you tend to end up with high blood pressure, issues with cholesterol, because they're all lifestyle related issues. And all of these are very damaging to your kidneys. So you actually end up with multiple reasons why your kidney could fail. But diabetes alone can do that. And so you want to monitor not only your sugar at home, but also your blood pressure. And by doing that, you're able to keep your numbers within a particular range. And I like my patients to get comfortable with knowing what their sugar levels are like and what their blood pressure levels are like. And, you become a part of your own management. And that's the best way to do it. And then, of course, you want to keep your appointments, make sure you get all your lab tests done. And if you're a smoker, you want to quit smoking. So smoking always makes everything worse. And here you have a lot of damage being done by diabetes. You do not also want to be a smoker. So why is it important to check your blood glucose levels? Well, it helps us kind of determine how to treat you. It lets us know how high your risks are for some of these diseases, as you talked about kidney disease. And so it gives us a lot of information. And there's different ways of doing that today. We've got technology that helps out a lot. So some people have continuous glucose monitors where they put a little pin thing in their skin, and they can actually monitor their sugar throughout the day and kind of even chart to see which foods cause them to have a high sugar load versus a low sugar load. So there's a lot of technology that's involved in there. So if you can afford it or if you get access to it, there are different ways to do it where you don't have to stick yourself all the time. But the common prick can be made easier by using a little, the little spring pen. I tend to use it in my office, and people are like, how come that didn't hurt? So there are different tools that you can use so that it's not as painful. But keeping up and knowing what those numbers are help us to really manage you really, really well. So you hear your doctor every once in a while might tell you to take some readings at home. This is a key, especially if you are trying to determine something about management or medication or insulin. We tend to want to see those numbers to make changes. And so as before, what should your blood glucose be? Well, here on the Cleveland Clinic website, it says 80 to 130. I tend to like my patients to be probably closer to 80 to 120 the most. And after you have a meal, it should be less than 200. They have 180. We tend to take less than 200. And so you should know those targets as a diabetic because that will help you in your management and let you know when your sugar is high or low. Now, the thing about diabetics is just as they can go very, very high, they also have periods where they can go extremely low. And it's important that they don't go too low because going too low also causes problems because we remember that glucose or sugar is actually the energy source of the body. And so you don't want to have your sugar extremely low, and anything below 70, our diabetics can also get some additional side effects. So it's a balancing act where you're going to try to stay between about 80 and 120. And when it goes low, we call this hypoglycemia. And so you might hear the doctor saying you went hypoglycemia, hypoglycemic. That is what we're talking about. And there's various symptoms. So as a diabetic, if you've been taking your medication or you've changed your diet quite a bit, and this is usually when people get like a little bit hypo, is they've made drastic changes in their diet. They're still taking the same medication, or they took their insulin or medication without eating properly, or they didn't follow some type of guidance, or they haven't eaten for some reason for a few days. They might be ill. It's important also to monitor your sugar at those times because you can end up with weakness and shaking, moist skin or sweating, almost kind of like chills, dizziness, a sudden sensation of hunger, confusion. If your skin can become very pale, you can have numbness in the mouth or the tongue, strange irritability or nervousness, unsteadiness, as well as nightmares, bad dreams, restlessness. Blurred vision can be both hyperglycemia and hypoglycemia, headaches, and even seizures. So you don't want your sugar to drop extremely low, and so we usually tell diabetics to keep something kind of sweet on them just in case that their sugar does drop extremely low. They'll be able to bring it back up. So it's quite the balancing act. So this is why you want to completely avoid being diabetic every way. And so if your sugar goes too high, what happens? What happens if your sugar goes way too high? And so we've seen cases where people, and this is how a lot of people get diagnosed, especially if they're not seeing their doctor. They get diagnosed when the sugar has gotten too high. And this is what we call hyperglycemia. And that is defined that when your fasting sugar is above 125 and your non-fasting sugar is above 180, but I say 200, it's gone too high. But it can go even further. So people can get 200, 300, 400, even as high as 500 milligrams per DL in their blood. And when your sugar gets that high is when not only do you have a lot of these risk factors increasing your risk for heart attack and stroke and kidney disease, but you can have, especially in our type 1 diabetic, something called DKA, diabetic ketoacidosis, where the acidic profile in your blood becomes extremely high. And when that is out of balance, you get really, really sick and you end up in hospital, and you can have GI problems, stomach problems, and vomiting. And people can die from that. So that is one of the scariest things. We see it more often in our type 1 or our young diabetics who are on insulin. And they have to come in hospital for sometimes days and receive hydration and medication just to make sure, because that can be a very, very scary thing. And the thing about being young and diabetic is always the problem of compliance of taking their medication. And so you'll see that their sugars can become very, very high. Now, type 2 diabetics, which is usually something that happens in older adults, you don't see it as often, but there are a few cases where a person's sugar can get that high and they do put themselves into DKA. So when we see a really high sugar and it's not improving, that can be an emergency as well, even for a type 2 diabetic. So you really want to be monitoring your sugar as best as can and doing with that. So today we have a lot of different oral medications that we use that But we first like to start with, of course, those lifestyle adjustments that we talked about, diet, exercise, all of that. And that usually our first step, especially if you are pre-diabetic. Some pre-diabetics today, though, we do sometimes put them on medication, a medication called metformin in a smaller dose than we would get our diabetics to just get their sugars back into range. And it also helps a little bit with weight loss. And for those of you who know, quite a few of the new diabetes medication we have in fact been using for weight loss. So some of them have transitioned. They were being used off-label, and they've been getting approval for weight loss in regular adults. And so some of those medications are being used even as weight loss drugs. So metformin tends to give the user a few of the first pounds of loss. And that helps to incentivize people to kind of keep going and keep doing that. And that's kind of the number one drug that we do use when we start a patient off with tablets for diabetes. It's a really old drug. It's really well known. One of the major issues with that would be kind of like GI problems. But we tend to not have a lot of people that can't tolerate that unless it's like a GI problem. So it's a really well-known drug that's been used for really many, many years, and no medication has been able to come along and be put on top of that. So that's the number one. So if you have any questions before we wrap up, 322-6232, 325-4316, 325-4259. You can join in on the conversation with a comment or a question. We're talking about diabetes, and we're talking about the medications that are involved, and metformin being one of the drugs that we do use. And that drug is really good to start you off with some weight loss as well. So, and some of the newer drugs that we have been using, of course, we've been talking about the fact that they also have been found to be really good with getting people to lose up to about 15% of their body weight. So we're all looking into those and how do we use those drugs in that capacity, because weight loss is a really good way of decreasing your risk because with the weight. But of course, with everything, you have to marry diet with that. Okay, we have a caller. We have a few minutes. You're on the air, caller. Go ahead.
Yes, good night, Dr. Archer.
Hey, good night.
Yeah, great show, as usual, right? So, the last time I had a blood sugar level of 92, and then the last time it was at 130. But at 32, somebody just eating a meal. I hate the finger prick, right? But one thing I hate about science is that you cannot remember everything when you're talking, right? And so there was Diabetes Week or month, and people is on the radio, and I know that some of the things they're saying is they're limited in what they're trying to teach the public. And so I don't know, about aspartic acid, in which they invented to replace sucrose in order to avoid diabetes, right? But we still see a rise in diabetes.
Okay.
There's not enough studies on aspartic acid. Also, you mentioned ketones. And so when I heard that, I was listening before that, but I just was tuning in from then. And so the ketones, when they are produced, that's from the fat. So it's not really a natural thing for the body to use fat as energy always. So then fasting would create this, and ketones cause an imbalance in the blood. So when you look at the fact that these ketones are produced by the liver and as a result of the cheap sugar. So the more sugar you eat, the more cholesterol you eat.
Mm-hmm.
I mean, the more cholesterol the liver produces. And so I'm looking at, if we really want to fight diabetes, the public has to be educated about what diet does and the fact that the body converts everything to sugar. When you deplete your carbohydrates if you're fasting, then the body turns to fat. But when the body burns fats, it produces ketones, right, Dr. D? It produces ketones.
Yeah, I mean, it's and usually, you'll have those ketones when you've starved yourself and you don't really not using your normal sources.
Yeah, and so but the ketones it's not a natural form of energy for the body exclusively.
Right.
And then what happens is after you're starving, real starvation, the body starts to turn protein into sugar through glucogenesis. So the body has ways of dealing with itself. But if you're looking at the whole situation developed from sugar consumption, like metabolic syndrome, and then the fact that I only use maple syrup or honey. Now with honey is the only sugar that contains the glucose and the sucrose and the fructose. And so we know that that fructose is not used by the body; it's only metabolized by the liver, and that's what causes the cholesterol. It says this right there. I've been fact checking it. You see what I'm saying? So if you understand the mechanism, then you would bypass some of these systems. And one of the disbelief, admits it. Do you really think there's no cure for diabetes, Dr. D? Unless it's something.
I would say the problem with diabetes, why I would say there's no cure, is because most people wait so late till they have organ damage.
Yeah,
and
I agree with you. I had a friend that died from it.
It's very difficult to reverse organ damage. So if your heart is already failing, you have a problem. Your kidney already failing. So that's why I say for my diabetics, if you're newly diagnosed with me, I am very aggressive with you in the terms that I do believe that most people, especially if they catch their diagnosis early, can live off of medication. You can maintain your lifestyle without medication. Sometimes you will need it, but it's how early you catch it. If you're having some type of end organ disease, you're most likely going to be on medication.
Yeah, but Dr. D, one of the things what is common sense is if the sugar is being metabolized slowly and it sits in the blood, it would obviously increase blood pressure. It's like by throwing something into a liquid, it will increase the density of the liquid. And so when you look at how sugar operates in the body, breaching the blood-brain barrier and causing dysfunction with the microbial cells that actually clean up dead brain cells, and it starts to attack healthy new nerve cells seen under the microscope. So what happens then is all this is linked to plaquing of the brain, dementia, and all of these different things. This is really all in your diet, but they being duping us. This is there. This is nothing. I'm not.
Yes, and there have been some studies on sugar and Alzheimer's and these types of things.
As far as cognition in the mice, etc. So the same thing. So when Dr. Stans told them the other day, diet plays a role in behavior, and they dismissed it as foolishness. That people they couldn't conceive it, but this is what the evidence is showing. And so when the thing is about sugar, it's everywhere, and people have to be realizing that even the beer I drink is sugar. But so I try to use energy. I try to use
because all of that stuff gets converted. So if you're not eating a balanced diet and you're having a lot of things that can be converted to sugar, you're gonna find that it's coming from a lot of different ways, and that's why people really need education earlier on their diets.
The key thing is to remember is that the liver does not the body does not the cells that use glucose. They don't recognize the fructose. So what happens is then this causes the liver to produce cholesterol. So the liver is the only thing that recognizes it, and that's why it's so hard on the liver. And I really would like for you, Dr. D. There's no conclusive study on the effects of aspartic acid, and there's two ways to make it. One is it's really the waste of some special type bacteria that they use, and they only did this to save money. They didn't do it because of health, and so there's no conclusive studies all this time now. People being consuming aspartic acid and hydrofluorosilicic acid and all these different things inside the water and the toothpaste, et cetera, et cetera. You see what I'm saying, Dr. D? So, God.
Well, I don't push any substitutes for sugar. I solely believe that you just need to.
I'll hang up because I know you're so soon in. But Dr. D, I use honey and I don't have a problem. Right. I use honey and maple syrup. My body, I don't even use the agave.
Yeah, that's a natural sugar. So I would say with most people, what they need to do is moderation. We don't have a very moderate diet in this country. We eat a lot of the same things. High starch diet, which is, that's going to go straight into being broken down to sugar very, very easily. A lot of processed sugar, which is just like pouring sugar into your blood vessels. And so, really our diets are the problem. And I feel, and I do not push for anyone to substitute sugar, but to cut down on sugar, because most of the substitutes are artificial, or they come with their own problems. And so you don't want to be substituting one problem for another problem. And so I don't advocate on any substitutes for sugar unless it's like the natural sugar with the stuff called stevia or whatever like that. But even with all of that stuff, you want to minimize your sugar content. So teaching yourself to tolerate foods with less sugar in it. Like if you're a coffee drinker and you know that you're putting sugar in your coffee every morning, If you're putting 2 tablespoons of coffee, two teaspoons of coffee sugar, cut down to 1. Just start weaning yourself off of the sugar because it is very addictive. It's very hard to get off of these things. And I would say that would be the key thing, to be able to cut down the quantity of food that you're eating and the amount of sugar and additional sugar that you're adding to your body. That's going to be what helps a lot. So we have got some comments online. Dr. G, our ancient ancestors and great-grandparents didn't have these issues, or definitely not as much. I wouldn't say that, because I would say that people died a lot earlier. So you'll have history of your great-great-grandfather dying at the age of 56. What did he die from? We're not really sure. So the diet was pretty bad in those days as well. I would say some of the difference then was that they worked a lot harder, so they may have gotten away with some things, but definitely we have some unknown deaths in a lot of families, and we have some young men in their 40s and 50s that died, and we're not sure of their history. So I wouldn't say that. I would have to really take a look at what was going on there. But I know that our life expectancy over the last 100 years has increased. So we're doing something a little bit better in terms of, I guess, maybe living longer, but that might be medication and different stuff. But definitely people during the early 1900s, and so they weren't living a really long time. The other comment is, the more we go away from eating natural, the more sick the human race will become. The Queen, may God bless her soul, had a natural diet. Well, yeah, and so it's becoming really expensive as well to eat really, really good. But right now we can see that it's just expensive in general to eat anything. So I would say to try to budget your money in a way where you're going with a healthier diet, because if you look at it, the healthy diet, the unhealthy diet, it's all expensive. So if you can put a few more vegetables in there and put back a few of those packaged or processed foods, if you can eat from a fast food restaurant less often, these things are going to add to your possibility of having a better health outcome. And of course, exercising and eating naturally, eating the fruits and the vegetables that we're growing right here at home. If you can get your hands on those things. Like I said, I always say I love Bahamian avocados. That's lots of nutrition, everything you're going to get there. So eating at home, we really have to look at producing more in this country, because that's going to give us our high nutrient value. It's going to give us the foods that we need for our environment. So the things that grow here are usually the things that we as people in the region would need and want. These are all really, really important aspects to health. And certain things grow in certain climates really because that is what's best for the people in those places. So the indigenous fruits and vegetables are super, super important to all of this and need to be incorporated in this conversation. But yes, diabetes, as we wrap up, really, really bad chronic illness. I call it the slow death because it does affect organs over time periods. It can be like a silent killer. And so we want to look out for it, because a lot of Bahamians have diabetes. A lot of us are overweight or obese, and a lot of us are not looking at the foods that we're putting into our bodies. And a lot of things like this chronic disease, diabetes, leads to some of these outcomes like kidney disease, as mentioned by one of our responders. So think about your health. Think about how you can better improve it, and try to consider that when you put foods into your body. So there's something that you can cut out. Figure out today what would be that one high sugar product that you can take out of your diet today. And that is a first step to a healthier lifestyle. So I want to thank you all for listening with me tonight on Guardian Radio. The doctor's in with me, Dr. D. Archer. And last comment, we need to check to see if violence and diet, yes, they do have a relationship. These children are not being fed well. It's affecting their brains, and I think it may be a part of our issue, but we have a multi-pronged issue that's causing violence in our nation. So take care, everyone. I'll see you all next week Tuesday at 6:30 p.m. on Guardian Radio 96.9. The doctor's in with me, Dr. D. Archer. Good night. Have a good one.